Good morning, and again, thank you for your patience as the Zoom gremlins are having fun with us this morning. We can go on to the next slide, and thank you, Heather. So real briefly about me, I've been a practitioner in the workforce development field for 20 years plus, and then as a capacity building technical assistance provider, also engaged with workforce providers. I was a wee child when I was working as a job search trainer and then a job developer in Indianapolis. Our program, Training Inc., had the very first performance-based contract under the Job Training Partnership Act, which may have been before some of you were born, but performance-driven culture has been my whole life in this field. And so I'm delighted to be with you, I know I bring a slightly different perspective, but I'm really delighted to be with you today. Let's go on to the next slide. I have the real privilege right now of working for Corporation for a Skilled Workforce, a national organization that's based in Ann Arbor, Michigan, that has been around for 30 plus years, whose mission is really to catalyze change in the systems of labor market and education, catalyzing change in both policies and practices to help increase economic mobility, especially for people of color and those excluded from success. It's a national organization. Many of us work virtually, and we work in 5 strategy areas, which you see there on the screen. CSW has worked in Illinois for years, particularly with local or state agencies and boards in workforce development around strategic planning, and actually did a benchmarking report and study several years ago around one-stop centers. One of the projects that I've been the most involved with is called the Workforce Benchmarking Network, which has really been around since 2008, and it's part of CSW's Improving Practices and Outcomes area. And it's primarily focused on that part of the system, which is community-based workforce providers, who often don't have access to the kind of capacity building that some other parts of the system may have. And one of our projects has been a national benchmarking survey for about 10 or 12 years now that's engaged hundreds of programs in reporting their population served, their outcomes, and their services to begin to see how their outcomes compare to others who are comparable. What we realized was it's not enough to know how you compare. And so for many years, we've been doing capacity building around through primarily peer learning cohorts of organizations, providing tools and technical assistance to help them look at how they use their data to improve their outcomes, not just know how they compare to others. And in some cities, we've also worked with funders and providers to think about what could it look like to have more of a shared measure effort so that we could really see what's happening across different parts of the public system and philanthropically funded system. Next slide. So we have a quick poll because I know that you're from many places around the state, and I can imagine some of the challenges you're facing, knowing what life in RIOA is like. But we want to find out, for the purposes of this workshop, what's a result that you find yourself most wanting to improve right now? And just pick one. I know you could pick all, but just pick one.
We have the poll going in both Zoom and Whova, so answer wherever you're most comfortable. We're watching both of them. Thank you.
Oh, that's impressive. Thank you.
All right, it looks like the Zoom answers have slowed down a little bit, so I'm going to close it in Zoom so we can see the results. And then Heather or Kirsten. Perfect, thank you.
Oh. All right, so recruitment, it looks like is a biggie. Keeping customers engaged is an even bigger biggie. I'm just writing some numbers down here. Measurable skill gains, 8%. Many of you have different focuses. Getting placements, initial jobs, repeat business, 8%. Keeping people engaged, 19%. And if the people who said other, if you don't mind, just stick in the chat if there's something else. If not, that's fine. This is very helpful and not unlike what I see on the frontline community-based provider side, particularly that of keeping customers engaged. So thank you. As we go into a couple of small breakouts today, you might kind of keep that challenge in mind as a way to focus your attention on how might I apply some of the ideas that we are talking about to this particular challenge. So let's go ahead. As part of these improvement cohorts, I wanted to give you a little bit more background. We have, over the years, through the Workforce Benchmarking Network, had cohorts of community-based providers in the 6 cities that you see there, including Chicago. And this was early on through the Chicago Jobs Council, who helped us pull a cohort of organizations together. All in all, about 80 organizations have been involved in these learning cohorts, and they have lasted anywhere from 1 to 3 years. The methods that we have used have been informed by different continuous quality improvement processes, like the Healthcare Institute for Healthcare Improvement, other Six Sigma kind of things, but they've not been sticking to a particular process. They've all involved, and this is the level from executive directors to frontline case managers, which allow them to really experience the different perspectives of functions in the organization, as well as have the decision-making capability to make changes. And in all cases, they have decided to focus on particular areas for their work, like recruitment or completing the program services or placement or retention, and all have seen some tangible, measurable improvement in the areas that they targeted as their challenge. And in general, they've experienced much more buy-in on the part of staff to actually using data, not just giving it to the manager to report to the funder. So their whole culture around data has begun to shift. If we can, next slide, Heather, thank you. We won't spend a lot of time on this, but just to give a quick picture of what their process has looked like. They've identified those big success measures, whatever they call them, that mattered to them, and made sure that we're clear on definitions, and then looked at how they were doing, both also in terms of equity, in terms of gender and race and other characteristics. And then they've said, where are some, we'll go into this a lot later, where are some key progress measures that they feel are what they would call leaks in their process, things that aren't going as well as they could be. And that's varied from organization to organization. Out of that process, they've decided to focus, because you can't do it all at once, on a particular measure that they want to improve. That's a milestone of some sort. They've looked at, they've brainstormed lots of hunches around what are factors that could be influencing that performance challenge, both helping and hindering achievement of that. And then they've gone deep into their data to see what they can understand around those hunches. They've also talked to lots of constituents or customers or partners to further understand that. Out of those conversations have come some ideas for change, or they've gotten feedback on what's working with their peers or in the field in general. And they've done sort of a continuous improvement plan, do, study, or reflect, act, where they are quickly coming up with some things that they want to try. The mantra has been, what can we do by next Tuesday? Let's not spend six months to a year making a plan. What can we do by next Tuesday? Try something small in a meeting next week. See what works, adapt, do it again, try it, and continue to tweak. And out of that has come some of these measurable improvements that we were talking about. Next slide, please. I think what's been driving this whole process is our experience in working with service providers is that they, as you, I suspect, are part of a system, a workforce system that by nature is driven by the funding that we're getting from higher up, which requires us to collect and report data, and which has consequences if we don't meet particular goals. And that system trickles all the way down to the frontline service providers, where their experience is much more of a burden than data as a resource, that data feels disconnected from what they care about. They may be responding to not only a WIOA funder, but also to a United Way or a foundation or other funders. And so it really does feel like something
are on staff, the last two.
Oh, thank you. Okay. Frontline staff, and I completely get this, may see that they're here to provide good services to their clients, to their customers, and it's often hard to see the connection of the reports they're having to give to their manager, to give to funders. All of this has said to us that it's important that we really work on how do we shift our experience of data around it being less of a burden that's only for a few people, that's really not related to my job, and has very much to do with accountability and compliance, but might also bring with it an element of judgment. What if I fail? Will I lose my job? Will we lose our funding? That's there, but how do we shift the balance between that experience to data more as a resource, which is also driven by what we care about, our mission, our vision, what we hear from constituents. The data really helps those constituents that I care about get better services. The data doesn't have to be intimidating. It's something I can participate in. And the data helps me make my own work goals, not just the bigger goals of the organization, and connects what I contribute to the organization. And yes, it's about accountability as well, it should be, but it's also about learning and improvement and innovation. So that's the shift that I see and that we have seen is really needed in the field around data. I know that it's tough when you've got performance measures hanging over you as a system, as a state, but I've seen at the frontline level, at least, that service providers produce better outcomes when they are focused on data as a resource. So next slide. So we're going to focus, there are really 4 kinds of principles or lessons that we've been taking out of this work for 10 or 12 years. And we'll focus more on the first 2 today, but we'll talk a little bit about the last 2 towards the end of the workshop. And these are focus on the results that matter to you and those you serve. Jump to questions and more questions, not conclusions with data. And particularly include in that data ongoing constituent feedback loops. Third principle is to make data and the reports that are created with that data more accessible and useful. And fourth, that without which the other 3 won't really happen, is commit to leading a data for learning culture. I know that my hunch is that these are concepts that are also useful and transferable in the WIOA environment. I hope you'll give me a little bit of grace. I'm not completely up to speed on all the WIOA comings and goings, and I've heard rumors about the statistical adjustment model and all of that. Hopefully what we can share today will give you just some things that might trigger your brain about ideas that can help us make data useful for improving our services as well as reporting on their outcomes. So let's go ahead on the first principle, which is focus on the results that matter to you and to those you serve. And of course, the WIA primary performance indicators are big goals that matter to you and those you serve. But I'm just curious to have you put in the chat, are there some other things you're focusing on in terms of big goals? Not that isn't a full plate right there. For instance, I know that there are some organizations that are focusing on how do we make sure that we have better performance in these areas by particular populations. How do we establish better, we want to establish better partnerships so that we can help customers access the other things they need in terms of related to housing or other support needs that they have. Or I know organizations that are working on, we want to help do something in the financial literacy area with our clients. I'm just curious, do any of you have additional big goals that you're focused on? Just put them in the chat if you are. And since I can't see the chat, somebody can tell me what they are.
Yeah, Heather Engelhart, can you read those out as they come in, please?
Yes, as they come in, I definitely will.
And if not, that's understandable. I just wanted to be sure and ask. The point being,
the chat is disabled.
You should be able to use the Whova chat. Sorry about that
Yes.
confusion.
Yes,
so please
go to
type
the
in
Whova chat.
Oh, I guess if you're signed in on Zoom, you can't.
The
Oh.
Whova chat is disabled also.
The Whova
all right,
chat
well, that's
is disabled? Okay, well, I will enable the chat in here since I am not on Whova right now.
okay.
And then
Or feel free to just unmute if you just want to say briefly what that is. And we can go on if that's going to be a hassle.
All right, the chat in here, the Zoom chat should be enabled at this point. Or you can unmute yourself and respond to the question verbally.
Any other big goals that you're focused on? And if not, that's fine. We'll just keep moving. Okay, let's keep going then. So along with the big goals, the data that matters to you, what we have learned, and I'm sure would make sense to you as well, is that the other data that matters has to do with progress milestones. And that's where improvement really happens. It's in each step of the way, doing things better or getting better results out of each step. And so this is a very generic kind of model there, but to say it has to do with getting enough applicants who are a good fit for what your services are that you offer. It has to do with getting enough of results that help people, that help demonstrate that people have the attendant, have the dependability, and have the ability to focus on the training and on work. So they've dealt with some of the other side issues that might get in the way. Those are results. Results that have to do with occupational skill development or certifications or skill gains in the academic area or credential gains. Results that have to do with people having both the documentation they need, but also that they've shown they can do a good interview, they understand how to navigate the job search system. Those are results. Results that have to do with the types of job openings that you're able to offer. In terms of the quality, are they across multiple sectors and different skill levels? And they all have to do with the kinds of relationships that you have with employers and how well they are engaged. Those are results. And how satisfied they are in terms of the feedback they give you. Those are results. And it has to do with the longer term results of people staying employed and showing income gains over time. Those are all results. And so the focus on progress milestone is something that we focus on the big stuff with our data. We don't often focus as well on the progress milestones with our data. And so that's been a big push and a big source of our work with providers. In the next slide, the image that we've used, and it may work for you, I don't know, has been where's the leak? Where are people literally falling through the cracks and you don't see them again? Or where are they running up against a brick wall and just not able to move forward for whatever reason? They're blocked in terms of achieving a particular outcome. So this is an example of what that might look like for a recruitment process. Again, very simple. They may attend an info meeting, but after that, you don't hear back from them again, or they may complete an application and then they don't do the other steps that might be needed in terms of documentation or testing or whatever it is. They may get accepted in the program, and then do they show up in a first week, or are they still there after the second week? Again, this may not apply to all your services, but I think you get the idea of using your data, however you have it, in logs or whatever, to understand where are people falling through the cracks. If we can go to the next slide. These are the types of things that our cohorts and their staff have really focused on. What results do we produce with our activities, and where's the leak? And so if you're a recruiter, as we just saw, you're really focused on that recruitment funnel. And this is data that you can manage yourself. It could be in an Excel spreadsheet. It doesn't have to be coming from somebody else. But you can manage capturing the numbers on the different steps of your recruitment process and understanding where the leak might be, and then begin to ask questions, which we'll get to later, about why might that be. If you're involved in training or just keeping people engaged, ways of if you're in a program, like a training program, you can capture attendance rates. You can also capture respond to call, respond to outreach rates. I'm always impressed with an organization in New York, Center for Employment Opportunities, that does a tremendous amount of work just with texting, with providing things like Net Promoter Score type questions. Would you recommend us to a friend? But also, how are you feeling this week about your readiness to look for a job? Asking particular questions about, how do you feel about your interviewing skills? Trying to get very specific feedback from folks via text, which they do, and they analyze it. They understand who needs more follow-up, who's engaged, and it also informs their thinking about where might we need to change our services a bit. And then they do a focus group. In the placement area, some of the data you might be tracking could have to do with, are they ready? Do they have a resume that we think is good? Do we have some indication they can do interviewing well? It might have to do with job leads, referrals, ratio to interviews, or ratio of interviews to hires. But you might also be looking at things like how many of the jobs we're placing people in are full-time or are offering benefits or pay a particular wage. How many employers are hiring more than once? I know that is one of the things you're looking at. And then again, on the employer side, looking at finding ways to quantify different levels of engagement. Are they a transactional customer who occasionally hires from time to time that we have to reach out to? Are they folks who on a regular basis are engaged with us? They reach to us. Are they partners and advocates in some way for our services and advocate on your behalf with their peers? Finding ways to categorize employers and how they engage, and then gives you a way to track as a milestone, increasing that level of engagement. And we're seeing a lot of the community-based providers doing this kind of data collection and using those kind of levels as milestones. Next slide. We also, as part of the work, have provided to help the providers a variety of worksheets that help them begin to brainstorm with each other about what are some of the key milestones that we think contribute to this particular measure, whether it's recruitment or program completion or getting a job or retention, whatever it is. So we use these worksheets with their teams, and they brainstorm and create the milestone results that they are going to track, because they don't want to track too many. 4 is probably too many. They may have 3 or 2, but what are the things that we're going to really start to track to help us know we're making progress? And then what might be some activities that would help us increase our results in those areas. We don't have the worksheets for you today. Because of time, we're not going to actually work with them, but I wanted you to see it, and happy to provide some of these sample worksheets for anybody who's interested in learning more about that. So as I said, this is interactive, and yes, please go ahead. Thanks. We're going to break into some breakout groups of roughly 5 apiece for maybe 15 minutes or so. I'm curious to have you think about, where does this resonate with you, this notion of progress milestones? If you think about the performance result that you said was a challenge for you, share an idea about what a progress milestone might be that seems important as a contributor to that result, how you're tracking it or how you could be tracking it, how that might be helpful. You may already be doing this, you probably are. So Heather, what's our next step here?
Okay, I'm going to open up the breakout rooms and everyone should be able to join. There will be about 5 or 6 participants per room. And then we will pull you back into the main room in about 15 minutes.
Thank you.
So as soon as you see the prompt, go ahead and click join the room, and that should be it. All right, we should have everybody back in the main room now. Thank you. I know some of you ended up playing musical breakout rooms because I was trying to put you where there were active discussion participants. So thank you, all of you. All right, go ahead, Marty.
And also thank you to the group that said, we don't know what we're doing, please come. And so I really appreciated that, and apologize for instructions that may not have been clear. Let's go to the next slide, and we'll talk it through a little bit more. I really appreciated the conversation I had in that one group where I think the first step is deciding the challenge area that you're focused on. And if I don't remember her name, but one of the women was working in the reemployment area. And I asked her, what are the steps? What are the key steps in your service that you provide? And one of those steps was having a one-on-one meeting. One of those steps was building a reemployment plan. One of those steps was meeting with them and getting some work done on their resume. And you could pretty easily track how many people took advantage of each of those steps. And I asked her, do you have any of those steps that has been tough getting people to do? And she said, yeah, getting them to do the resume part's been tough. And so that's an example of what you might call a leak or a roadblock, whatever image works for you. And you could probably see that if you were tracking the results of how many came to the one-to-one meeting, how many reemployment plans have been completed, how many resumes have either been created with you or at least had a look over to say, yeah, that's okay. But that could be a milestone you decided to focus on there. So step 1 is, what are your key process steps? What are the results? How do you know you track? How do you track those as having been accomplished, whatever that means? And then where's the point of leak or challenge? It gives you an area to focus on. So hopefully that's clearer. Better late than never. But I'm curious, we just have a little bit of time for some quick feedback. What, as much as you were able to talk about this in your own groups, what do you see as the value or benefit of focusing on a milestone? And you could even give us an example of one, if someone's brave enough to unmute and just talk about it a bit. Or put it in chat, because chat does work now, right, Heather?
The Whova chat is up and running.
Okay.
We've just got Whova chat right now.
Yeah, I'll announce it. Yep, chat's working over here.
So what's a type of milestone that you talked about, and what's the value of working with that as a progress measure?
Well, I'm I was saying in the chat room, I'm actually a training partner. I'm
Great.
not, yes. And
Part of the system here.
yes. and I was very interested, one, in the opening part when you were asking about where's the leak, but I know the question now is focusing on a milestone.
Oh,
And
yeah. Where's the leak? It's the same question.
well, one of the things, and I mentioned this in the breakout session I was with, is I make a concerted effort to refer people to offices, and my company is in the northern Illinois area. We're in LES 7. I'm physically located in 7, but I work virtually all over the state. But particularly since we're now remote, but one of the things I found is some of the people that I refer will drop out mainly because of the time that's involved. Now, I know that doesn't refer to the milestone in particular that you're speaking of, but some of these customers will come back and say, well, it just took too long. I don't have that time to wait, or they'll come back and say, I got a job offer. So, I'm not in the process any longer. And so, I understand ultimately the idea is to get a job. That's fine. Those who got a job, that's wonderful. But the problem is some of those that are sitting and waiting, and they just eventually just get tired of waiting. Now, one of the milestones I wrestle with all the time is getting that credential. Now, certainly my certificate of completion is great, but I want them to get the industry cert. I want them to get the certificate. I tend to work more in the business services, development, and IT side of things. I want them to get the certification, the industry certification that makes a difference when they go out to the job. I want them to be confident when they go to the job that they've got this certification, and that will make them stand out when they're going to interview.
Yep.
So I'm kind of the two areas that I have, and I run into this often when I talk with the service providers. They'll say, well, the people need to be going and getting their certification. I agree. So I'm trying very hard to motivate them to do that. But at the same time, I'm looking at the time frame it takes them to get started in a program where they can get the certification. So I'm just saying my being here is to try and be a better partner in this whole process. Yeah. Refer better people, get more people certified, put more people through the program. And those are the two biggest pain points that I have. Okay. Is the time that's involved, and with some of the people that I refer, I actually use a 50% rule. I say that if I refer 50 people, 25 of them are going to wind up in the process. And of that 25, maybe 12 or so are going to wind up going through and doing the things that they should be doing. That's going to help them get back to work. And I'd like to see that number different. I think that's, I'd like to see that number different.
And what you're talking about, Ralph, is exactly what we mean by the milestones. If it's that 50% deal, what would it look like if to say we want to raise that 50% who are referred that get into the process to 60%,
right?
As a milestone goal,
right?
That's a great example of a milestone. And when you say time to get started, what are the factors there? Is it's having to do with when courses are available, or?
Well, let's a person, I refer a person to a service provider. They have to, obviously they go through the process at that particular service provider office. And those processes are basically the same in most of them. There's an orientation, there's verification, there's a process you go through, and so forth and so on from there. It's that process of the orientation to being assigned a career coach to going through the process, whether they need to be tested or not. If they don't need to be tested, getting through the workshops that are there, the workshops that are scheduled, those seem to be kind of factors that hold back some of the people that, or at least that's the feedback that I get.
And that makes sense, and you're getting that feedback from the customer, from the constituent.
Yes.
And so I think, Alejandro, yes, I think everything you've talked about is an example of a milestone that could be tracked and how do we make those less time consuming? Alejandro, yes.
Yeah, I was just gonna chime in with regards to the last part that Ralph said, as far as you know, I work in the I work I'm not a WIOA provider. I'm a veteran rep within IDES
Thank
who
you.
helps veterans at times. Thank you. Who helps veterans at times get employment
Yeah.
and get certification through WIOA. And yes, if you're speaking to certain people certain clients or customers or mentees that you're helping get through programs, that's going to be a recurring topic, that the processes in order to get them the training can be cumbersome and and kind of rigorous. But the thing is, we always also have a obligation and responsibility to ensure that whoever they're getting into these programs can meet the set requirements, and they have to do their due diligence.
Yes.
So the real thing is getting the support on the back end, ensuring that whatever they're committed to doing,
Right.
they're going to be kind of stable to do. And that's the kind of mind frame you have to approach it, and respectfully, is when you're dealing with that, not absorb that into you and think, I got to find a way to stress to somebody who has a process and a system that that does provide success. Yes, the percentage rate, the gap as far as completion could be better, and it will be better. But from me, or you, to tell a WIOA partner the process that they know has given them success is wrong, is kind of complicated, because we don't know their full processes.
Yeah.
It is absolutely complicated, and my experiences is not a matter of right or wrong. It's the fact that we have, as you said, there's a balance, a tension
Yes.
between what our people that we're serving want and need, and what we know, what our values and goals are as well, in terms of making sure that what they get into is something that they have a good chance of being successful in. I mean, I've been there.
Balance. Yeah.
And so what the data does is it at least points, it's like a flagpole that says, we've got an issue here that we need to talk about some more.
I guess
it's a prompter for conversation.
Where I'm trying to really, where I guess going back to saying all that, what I want to emphasize is a mantra, like a motto that I like to go by, is that, if the grass is always greener on the other side when you're looking at it. But if you focus on your grass, and you put the attention to your grass, you can make it just as green, if not greener. So with that in mind, when you hear that, like, hey, this process is taking me too long. Well, look, this is the process, Jimmy.
Yeah.
You have to learn how to balance your life to meet that. Is this your goal? Do you want to be an IT specialist? If it is, let me help you balance your other work life so you can be able to meet your objective to accomplish this, because that process is not going to change.
Alejandro, I definitely agree with you that, and I certainly think the value of it is really there. That's something I try and stress with those people when I run into that. This is a terrific opportunity. It's a great value. It's worth the effort. It's worth the process to go through. I completely agree with you there, and that's really the approach that I take with them. And I'm not saying that the process is wrong. I'm just saying that that's just one of the items that I run into. I tell people that I'm going to refer to an office. I say, that this WIOA system requires three things. There's nothing out of your pocket, but it requires three things. One, you're motivated to do it. Two, you're committed to completing it. And three, you'll give it some priority. And that's what I try and instill in anybody that I'm referring. And I get that, and I'm working on that. You're absolutely right. I think this is a great opportunity for anybody that gets into it. I certainly understand that you have to find out if the person really does meet the the guidelines of WIOA. I certainly understand that. Just mentioning one of the things I get back from feedback on them as far as the process is concerned. I think I've been involved with WIOA for the last 20 years. I think it's a great program. I think it's helped a lot of people. I think it helped a number more people. I think it raises the boats of everyone that's out there that's unemployed or underemployed. I think it's a great program. That's why I've been doing it so long. I fully embrace it. The reason why I'm here is to try and figure out, is there something I can do to help anybody else and maybe even change that percent, my 50% rule to maybe 60%.
So we're going to take a break in a minute, and I really appreciate both of your comments. I think it points to one of the values or benefits of having these, what I'm calling progress milestones, where you see where are people not getting as far as they might want or need to get. It helps you, it then creates the need for a conversation like you have had. One of the benefits is it helps you talk about what's getting in the way of the big goals, credentials or jobs, and how do we incorporate the multiple complicated perspectives in figuring it out. And we'll talk a little bit more about that in the next part of that.
Marty, I do have one from the chat too. I'd like to share before we break from Shamir
Absolutely.
Brown.
Thanks, Heather.
Students completing one of their 4 GED modules as opposed to waiting until they are prepared for all 4 before attempting. This is a milestone that we are assisting our students in recognizing, helping them to understand how this enables them to cut down their class time and allow for focus on areas of struggle. Thank you for sharing that, Shamir.
That is a really excellent example, Shamir, for many reasons. It lets you know if you're in trouble already, but it also allows you to celebrate with that participant progress, which is a huge motivator and energy provider for the next module. So thank you. All right, well, hopefully I've raised some questions and not gotten answers. So we're going to move on and take a break for about 5 minutes and then come back at 10:40.
Thanks, everyone. Thanks,
Thank
Rob.
you.
Thanks, Marty.
Thank you.
I say we go ahead. What do you think, Heather?
Sorry, I was muted. Yeah, I mean, she did say 9:40, so go ahead.
All right, let's move along then.
Oh, sorry, I probably said 10:40. I'm Indianapolis.
I don't think anyone thought they were going to get an hour break. Don't worry.
Yeah, you're good. You're good. You're good.
All right, sorry about that. So if principle number 1 is focus on data that matters to you and to your constituents as well, principle number 2 is when you have that data, jump to questions and more questions, not conclusions. As human beings, we tend to jump to conclusions pretty quickly about data that we hear, and make sure that you have some ongoing constituent feedback to help inform those questions. And that could be your job seekers, it could be your employers, it could be your partners. Those are all stakeholders that you want to keep in the mix. But the jump to questions is important. And there's all kinds of questions you could ask. Questions of context, which means we got 200 placements this year, and it's like, is that good? I don't know. Compared to what? Compared to our goal, compared to last year, compared to what similar organizations are doing that you would say were peers. You've got to put that data in context. Then there are questions of validity. I am sure every one of you has seen a data report and you go, no, that's just not right. No, something's missing there. Are we doing the kind of data quality work that allows us to trust that it's data, at least as far as our gut? Are we sure it's getting the whole picture there? A lot of organizations that we have worked with have used the questions of being more specific, going deeper. Who is succeeding? When are we seeing success? When not? Where are we seeing success? Where not? And we'll talk a little bit more about that shortly. And then the other kinds of questions are the big why questions. What's the connection of this result to some other stuff going on. What's our hunch? What might be factors that are related? Because it's just a hunch. So next slide. So in terms of going deeper, disaggregating our data is just a key way to do that. As much as we are able, whether you can get it out of your database or you have to do it yourself. Who is not achieving results as well as others? This is work that one of the programs we worked with in Philadelphia, who thought they had a great placement rate, and they did, until they looked at how the numbers of enrollees who were completing training and were then placed in tech jobs broke down by race and gender, where they realized they really had work to do, particularly in working with their Black participants, and in some cases, they're male participants in terms of placement in tech jobs. But they hadn't seen that until they did that disaggregation. It was so important to them. In another program in Philadelphia, that is almost completely people of color and who they serve, like 98%. They discovered that those who did not complete the program most were young Black males who were also parenting. They did that kind of deep dive to understand that that group had special issues that needed to be addressed relative to childcare and their juggling of family issues. So they had to go deeper and really understand who's not getting the results that they want. Where are results better in recruitment? Organizations a lot of times that we've worked with have done extensive work with zip codes, understanding who's coming from what zip code, and why are they coming from this zip code, which ought to have a lot of referrals. What's going on there? But just disaggregating their applicant base by zip code and where people tend to fall through the cracks if they don't enroll, and understanding what else might be going on in that location. And then when are we seeing a drop off? I mean, simple things like a program we worked with that was a short-term job readiness program, realized that it was a 3-week program, and people kept taking long weekends, Thursday, Friday, Saturday, Sunday. And so Thursday was where the drop off was, and that's when they had guest employer speakers. When they realized that, bring them in. These are employers. They're going to come talk about how you can work at my company, and attendance improved. Surprise. But just simple ways of understanding as you can where the issues are by going deeper. Next slide, please. Then understanding that kind of information, then what we've done is begun to use an adapted version of what people sometimes call the Fishbone document or diagram, or otherwise known as cause and effect. They look different in many ways, but it's a brainstorming tool that allows people to give a lot of different perspectives on what they think is underlying a particular challenge. And so we used that approach. And if we can go on to the next slide, sometimes the traditional Fishbone diagrams can get pretty unwieldy with lots of brainstorming going all different directions. And so we also created a worksheet that helped with some initial brainstorming. And let me share with you the kinds of factors that we were looking at. This is just an example where the goal that was on that Fishbone in the last slide was improving our 12-month retention, roughly akin to your employment at 4th quarter after exit. And so in our organizations that we would work with, are focusing on 1-year retention, they would get around the table trainers, case managers, job placement people, admin, executive leadership, a variety of perspectives, to just from their different perspectives say, what's our hunch about what could be enhancing success and could be hindering success? The two are related. One of the things they looked at was participant factors, which have to do with what do we know about the participants from a demographic standpoint, from a standpoint of what else they may be dealing with, what challenges they may be facing. And so someone, for instance, said, I have a hunch that those who aren't being on the job at 12 months are facing more demands from a childcare or a parenting than those who are working at 12 months. It's a hunch, it's a hypothesis. Or I have a hunch that those who aren't being on the job, who aren't employed at 12 months, maybe came in at a lower education level. Maybe they didn't have their GED, or there's something else going on, as opposed to those who have a degree, a high school diploma, or even a little college work. I have a hunch. In one case, our organization was training people to be hotel housekeepers. I have a hunch that physical stamina is a factor in people staying on the job. So those are participant factors, things you can't do anything about. That's what they come in with. Service factors are the factors that have to do with what you do, what service you provide, how long or intensive it is, what services you don't provide, how well you provide them. And so it's what happens in your space and in your interactions. So there were hunches that if you looked at the attendance rates or the engagement rates of people who either didn't have jobs at 12 months or did, you would see that the folks who did have employment at 12 months had also had better show rates in your services or better engagement with you. That there might be a correlation there. Somebody else had a hunch that the reason they weren't staying on the job at 12 months was that we hadn't done as good a job as we could to use what we'd learned in their career plan and really match that to the job we put them in. Or that maybe we had put them in a job that wasn't accessible in whatever way, either from a disability standpoint, or more likely it was just you couldn't get there from here in terms of where it was located. Other people had hunches about it had to do with the job pay or the different kinds of job quality at different employers. These are all hunches people would come up with that had to do with what we did, what we did to get them employed. Then there are also staff team factors or personnel related factors that have to do with how many staff you have working on this, what's their capacity, what's their skill level, how much do they talk to each other as a team in terms of sharing information that might be useful. So those are the types of factors that go there. And a hunch had to do with maybe the caseloads or the time the staff had to do the needed follow-up for the 12-month work. It's not there. We need more staff. Or maybe it's just not clear on how much is expected and how to do the follow-up. Or maybe it had to do with the skills of coaching someone that's sort of waffling on a job. All of those were potential factors. Another category is information factors, which really has to do with what we don't know. Like maybe there was a lack of real information about why people had left their job. The real reason. There's always the reason, and then there's more often the real reason that if you're lucky, you can ascertain. And that we hadn't gotten a lot of feedback from the employer. We weren't doing enough, didn't have enough data from the employer as much as they can legally provide it. The last factor that we always put out there, because it's a factor, is environmental factors. That's the big stuff, the system, big stuff sometimes that you can't do much about, perhaps like a pandemic. It's a factor, but we can't fix it. The benefits cliff is a factor. It's going to take a lot of work to fix that, but that could be a reason why someone decides to leave a job. Racial or gender bias on the job could absolutely be a factor. It's harder to get in there and do much about it in the short term. And just resources from a funding or policy standpoint could be a factor. So those are the types of factors that our cohorts would brainstorm as staff teams with multiple perspectives. And they also would keep asking, yes, that's true. And why is that? And then why is that? Trying to begin to get down to what are some of the more root causes that may be longer term, but they're important to identify relative to structural, the way that we have structured the process kinds of issues. So that was important to do. So doing this brainstorming, then the groups would choose a few key hunches that they thought were probably most worthy of further exploration. And we can go on to the next slide, Heather. And so that's where they would go back to this Fishbone worksheet, and they would list a few of those that they wanted to test their hunches. Like they would test whether age or parenting status or education level had any correlation at all with who's working on the job at 12 months. And you could basically get that from your intake database. And they'd just be looking at, is there any difference between those who are working and not working at 12 months tied to those factors? The service factors, you could also look at attendance information. You could look at follow-up contact logs. It's a little bit more work to do, but they went and looked at career plans and how people were matched to those. So, the staff got kind of involved like Sherlock Holmes in these things of, it's like, I'm going to figure this out and see what I can learn. In the staff team factors, they just had a good conversation with staff about capacity, about the follow-up process, about what was needed in terms of coaching skills. And then in terms of information factors, one particular organization did several focus groups with graduates on the job who may have left the job before 12 months, as well as with employers that were their partner employers they could have candid conversations with to understand what was important to them and why, and from their point of view, some folks might not have stayed. And there were a variety of things that they discovered, like the parenting status of the participants didn't seem all that involved in the 12-month thing. It seemed to work either way. They did discover, for instance, that people who didn't have their GED had a harder time still being working at 12 months. You have to understand why that is, but that was an interesting finding. They discovered that things like job match seemed to be more important to the 12-month than the frequency of someone reaching out to them, which was a surprise. Now, this was not a scientific, rigorous research project, but began to point to what might be important to look at for good ideas as strategies. One of the things they heard from employers was this particular program, their technical skills are fine, but we've had trouble in terms of their taking initiative and going the extra mile kind of piece. And so that was really good feedback for their curriculum. All of that is to say that through this kind of process of brainstorming some hunches, and then figuring out who can we involve in conversations about this, what data might be available to test those hunches, can then lead to some really good ideas for what might we try doing differently. And that's the next step in the process. Let me ask where you have a question. We're going to go into another little breakout time shortly, but where do you have a question about just how, what this process was, the brainstorming in the earlier slide or the getting input from your data and feedback there? Heather, can we go back up to the slide above as well? So this was just an example of some brainstorming that an organization had done relative to retention. But where do you have questions about how this worked? Again, the difference, I don't want to miss questions. Participant factors are those things that you think might be important. Yes, go ahead.
Carrie Thomas wants to know, is this brainstorming with a lot of staff, or just one staff person and a supervisor, for example, a staff person and supervisor, for example?
The more people, the better. Then, I mean, you work with what you have, but the brainstorming is more rich if you have other folks who might not be in the thick of it, who have a little bit broader perspective and could say, is there a chance that this is also a factor, or this is also a factor? The case manager may have a different perspective on why someone is struggling than the job placement person. So that's the get multiple and diverse perspectives. Thanks, Carrie, for the question. Other questions? One of the things that this does is it's easy to blame the participant when things don't work, like they're just not motivated. And motivation may be a piece, but there may be other things going on there. And it might also have to do with the way you're doing your service. That's not, for helping to, improve that motivation. There's lots of factors, as someone said earlier. It's complicated. Other questions?
Of the participant factors, how important is age? I know we've got the youth program. I'm talking more on the adult side. How important is age, and when you start to get individuals, let's say they're above 60, how is that? How important is that?
Well, first, let me say this was a brainstorm. This was a hunch. These are not conclusions.
Mm-hmm.
I can say that in the work that we've done with organizations, in this case, we had the organization had a hunch that those who were under 20 in their first job were likely to have a harder time still working in a year, just for pure lack of experience and a little bit of brain development going on there, but I don't know the answer. It might be the same thing for people like me that are over 60, but I think that, again, this was to look at the data. What does the data tell us? Do we see any difference in people that are over 60 still working at 12 months versus, those in other age groups? And it was just to test the hunch. What does the data say? And that's all it was, so that you could rule out maybe some factors that, according to the data, weren't that big a deal anyway. So, good question. Thanks, Rob. Other questions? Okay. If we can go to the next slide. Oh, next slide after that. We're going to go into breakout groups, and you're going to focus on one challenge. I'm suggesting that whoever shows up in your group, the person whose last name is last alphabetically, share a challenge. If you absolutely don't want to do that, say that, but this is, you get a chance to get the group's input here. And take 3 minutes, no more, to just come up with a challenge that you'll decide for the sake of the next 17 minutes to focus on. And so then you've got, again, I don't have a worksheet because it was too complicated to do with Whova and all that stuff, but to talk about what would be 1 or 2 hunches about factors that are influencing that challenge. Participant factors, service factors, staff and team factors, and information factors. And I'll put that, or I'll maybe ask Heather, one of the Heathers,
Yes.
to just copy and paste these instructions into the chat.
Yeah, Heather Engelhardt, can you please put that in the Whova chat? That'd be
Got
great.
it.
Thank you.
All right.
All right, I'm gonna open up the breakout rooms.
One more step. And then just talk. You don't have to cover all the factors, but just for some of those hunches, talk about what sources of data could help you learn about those hunches, including who you could talk with to learn about whether that's a valid hunch or not. Okay.
Okay, I moved some of you around so the rooms are a little bit bigger. So hopefully you'll have a bit more of an engaged conversation. All right, I'm gonna go ahead and open the rooms and they'll be open for 20 minutes. The directions should be in the Whova chat, and I will also broadcast them to the rooms as soon as they're open.
Thank you.
You're welcome. All right, it looks like everyone is back in the main room now, Marty.
All right, thank you. Let's go on to the next slide and just talk about this tool or this process of looking, what's my hunch about influencing factors, which is one way to not just quickly jump to conclusions. In my mind, this tool is, you start with data, how many people are showing up, what percentage is that of those that we thought would show up. That's just data. Then this is really a conversation about why. And it's as much about conversations to understand what different people's experiences to better allow you to understand the challenge and to then allow you to make perhaps better informed idea generation for what could we do that might help address concerns of multiple parties if possible. So anyway, I'm curious, for those of you that were able to engage in a conversation, how was this type of process useful? Where might it be helpful in your own setting? Curious to have anybody's comments on that.
Feel free to unmute yourselves, or you can put it in the Whova chat.
Yes, thank you.
This is Eva Locke from LWEO1. Just our group talked about our topic or challenge that we selected was getting young people enrolled and retaining them. I'm sure this is a pain point for many organizations. And we talked through some barriers, such as childcare. Some siblings are having to care for their younger siblings. Transportation. Some are maybe they initially committed to training, but then had to go work to support their family. So just some ideas. But one of the things we talked about in terms of then verifying that those theories was that that's not information that you can find like out online. It's stuff that you need to talk to community providers, people who work with young people, parents, to try to get those answers.
Yep, that's really helpful, Eva. I'm just curious, I don't know how far you got in the conversation. Did you talk about any factors related to the services that were being provided that might also, influence results there?
Not as much. We just had Ralph threw out a really good idea. I'll call on Ralph about what they are doing as a training provider to inform young people about careers.
Well, that's okay. We can hold for now. I was just curious if you've gotten to any of the other types of factors. It sounds like you had a really good conversation on the participant factors, though. And you're right. The data is really stuff you hear from others, like partners. I think that's exactly right. And it's all data. So thank you for that. Anybody else want to share what you talked about? And
Herman was saying that he thinks working with a mixture of virtually and in person has allowed him to accomplish more in terms of how many veterans he can communicate with on a daily basis.
Yeah.
And he's wondering if other people have seen this pattern as well.
That's a great example of a service factor, that your ability to do a hybrid approach allows you to be much more accessible. That's a great example. But he wanted some feedback to that, Heather.
He was curious if other people have noticed the same pattern.
Feel free to respond to that in chat or unmute. And anybody else, any observations about how this is just a tool or a process for conversation among staff, and then additional conversation with others who could inform your thinking? How might this be useful to you in a particular challenge that you're working with? What comes to mind there? Okay, well, if you have an interest in any of the worksheets that we've used with service providers, they've really been, people say it's been very helpful for them in their service delivery. And so if you're interested in learning more about that and in getting some sample worksheets, my contact information is in Whova, and it's also in these slides. We'll be happy to help there. So let's go ahead. Heather, did you want to add something else?
Marty, I was just going to say that there is one worksheet that you had sent that has already been uploaded to Whova, as well as the PowerPoint. So anyone who is in Whova right now that doesn't see that, you can just refresh at any time, and those materials should be in there. And then I think there was one question in the chat that Heather was going to read. Heather, was there something else you were going to ask from the chat?
No, I think I got it.
Okay.
Yeah, because the other one was like during their group session.
Got it. Okay, thank you.
All right. So before we wrap up, let me just go through a couple of the other principles that we had talked about. We can go on to the next slide. In terms of what makes any of this possible, if you're trying to learn more from data, it's important that the data is more accessible and is in a report form that makes it useful. And so I realize people are in different places with many confidentiality probably concerns, as well as just technology or policies that don't allow complete access to data, and that makes perfect sense. But it's also helpful to say what would be useful for staff to have so that they can do their jobs as effectively as possible with the data that exists. And so, for instance, reports that would help staff do their particular jobs, like some kind of report that shows what's the number of folks that we've referred, or who's been referred from a variety of community partners and referral sources for XYZ certificate program. Just having that kind of report, and then seeing, of those who were referred, you could say, well, so-and-so never actually enrolled, or most of those folks dropped out, or maybe they weren't as clear about what was needed for this particular program. Maybe I need to have a conversation with that referral source so that they're clearer on what this program offers. They could do that if they had a report, even if in Excel, about who's come from where, from whence, and how did those folks do. Or it might be a report on the business development side. What do we know about our employers in terms of history, in terms of the jobs that they've offered, how many have been full-time versus part-time, how many have been at a certain wage level? What do we know about people's retention rates with that employer? If I'm a job developer, oh my God, and I have been, that would be so helpful to have. So you're not just trusting the brain to remember, who are some employers that look like, great ones we want to continue to work with. So making data, or asking staff what kinds of simple reports like that might be really helpful, even if only in Excel, I think is a way of encouraging staff to use the data they have to help them work smarter and more effectively. In our organizations that we've worked with, you could never do enough training on how to use the data system that they have. And sometimes that training looked like more of a buddy system with an informal mentor from someone who's been using it for a while, but just helping staff get what they need to really know how to use the system and get the most out of it. Obviously, data quality is a huge concern always. Is it accurate? Is it complete? So some clear quality control processes there are useful. And what we've experienced with the providers that we're working with is in their performance evaluations with staff, if they have something in there that ties data quality and data timeliness to a performance rating, that helps in terms of a little bit more of a carrot to encourage staff to get the data in that needs to get in. Let's go on to the next slide. This last principle is probably should be first, but I didn't want to start there, but it's that which makes all the others possible. If you're really trying to move beyond using data just for reporting or compliance or accountability is good, but if you're trying to move beyond that to how do we use our data to make our services better and improve our results, leadership has to not only talk about that and to see that, but to model using data for learning, and so that they're talking as much about that as they are making our goals, because the two go hand in hand. Likewise, this stuff, as you can imagine, takes more time. I don't know if it was Paul or someone who said we don't spend enough time in reflection on the data. We tend to see the report, say, okay, we're doing okay, and move on. But it takes time, and that's an investment of resources. Even more important might be how do you embed some short conversations around your results and why they might be those results. Some of that, what's our hunch, is the trick is sort of embedding it into how you do your work. Well, a good colleague of mine is the Jane Addams Resource Corporation in Chicago. And as a result of doing this kind of work, they just routinely build into their staff meetings a chance to do a little bit of what's our hunch around a particular issue, or to look at a particular set of data around employer engagement or around who they're recruiting or whatever, as a way to just say to the staff, this is what we do. So it takes investment of time, but it's well worth the time. Yes, you need a user-friendly data system. Of course you do. But our experience has been that is not the magic bullet. It will not solve your performance issues if you're not going deeper into the data that it produces, and if you're not talking about and finding ways to use the data. So that's important, but the learning from it is even more important. And then these other things are sort of tone stuff. If poor results are something that is something people are afraid to talk about because of a sense of that there might be a punitive response or a judgmental response. Managers and leaders set that tone. But if results that aren't what you want are seen as an opportunity for learning, if there's an encouragement to try some new things, kind of the what can we do by next Tuesday, and that making mistakes is how we learn. Those are the kinds of things that in the long run will make a difference. I know the stakes are high in terms of performance measures, but still in the long run, these things make a difference, and management sets the tone there. So it's permission to fail fast, and improvement is celebrated. Not just reaching our goals, but just doing better is celebrated. And then lastly, last slide here. Many of you in the next slide are also funders of others. Oops. one more up. Thank you, Heather. There you go. Particularly as you are funders, I think your role is helping to support the system as a whole, including providers, as learning partners, involving them as helping as you can to build staff's capacity to learn from data. But when I say learning partners, it's not just saying, did you meet the goal or not, but what are we seeing in your data that might tell us some things that are shifting, or what are you interested in learning more about? And kind of being a partner in that thinking. What are you finding out in your conversations with people are needs that aren't being met? Your role can be that of convening some of those partners and raising those questions, creating that space to dialogue as a system, whatever system means, and to reflect around what the data is saying and why that might be, what are the stories behind it. And then to just say, what else could we do? Yes, it's a big ask, but it's what I hear in the field a lot. And so this is meant more as a thought provoker, just, what could we do in a small next step, take a small step kind of way to do this. So that's what I'm going to offer. The next slide is, we've got 3 minutes to, I'm just curious if anyone has a question or some insight they're taking away that they might they're thinking about a little more, or maybe something you've already decided, I might try this. I could do this small thing by next Tuesday. So I'm just curious, put them in the chat, or, be even braver and speak them out loud. As Heather mentioned, there is a worksheet that's sort of a self-assessment that we've created for organizations that really pulls together a number of the ideas we talked about today. And it's a self-assessment that could be done as a small team around all these elements of creating a data culture that supports improvement. And it's a 2-pager that many of the organizations we've worked with have used as a conversation starter around how they could do better around, learning from their data. And then they've used that to generate some very specific small next steps they want to do. So I'm offering that as a takeaway, and it's, as Heather said, it's been uploaded into Whova. Evaluations, what happens there, Heather? Do they?
Okay, well, at this point, so what happens is you can just make sure to continue with the engagement and networking on the Whova app. There will be evaluations posted on the Whova app, so you can go ahead and click on that when everything is done and submitted on there. And, we look forward to seeing everyone in the future with future sessions or next year. And we thank everyone for attending today. And Marty, thank you so much for all of this wonderful information.
Thank
Marty,
you.
I actually did just get a message. I just got a message that said reconfigure questions on intake form so that we can analyze demographics of who is completing entire onboarding process.
It's a great next step. Thank you. Thanks for sharing that.
Great.
Thank you all. Have the rest of the conference. Hope it goes well. And thanks for all that you do.
Thank you, Marty.
Take care.